Hello everyone. Today, in the academic session of this clinical examination, we will be discussing about the peripheral signs of aortic regurgitation. When we are mentioning about the peripheral signs of aortic regurgitation in cardiovascular system examination, particularly in GP, we know that there are numerous named signs, and most often the complaint by the students will be like, there are too many named signs. How to remember all those things when it comes to aortic regurgitation? So today what we will do is, we will go through a crime thriller story so that you will remember all the peripheral signs without fail for lifetime. So we'll deal that now. So the topic for today is peripheral signs of mainly chronic aortic regurgitation, chronic AR. Okay, so our story starts with a fight scene directly. Here, for one of the most popular personality, somebody will shoot him. So the thing is, a shooter with a gun. So that is Cory gun. He has shot the famous personality. So using pistol. So pistol shot. Immediately after that, that famous personality has collapsed. Okay, so after that, the family members and the near and dear ones will take the body for funeral. Okay, near a hill. So it was his wish to get buried near a hill station, and there was a lighthouse there nearby. So they took the body to the hill, and there was a lighthouse nearby. So when the funeral was going on, the near and dear ones to the person were standing in a queue. Okay, suppose this, if we consider as the funeral process going on in the center, so that dear ones were standing in the queues. Dear ones, very dear ones, were in the queue. All other people, because he was a very famous personality, were standing and crying. Okay, so all other things in the surrounding were standing and crying. So just consider it as pulsatile. So many structures in the surrounding are pulsatile. Okay, so we'll just mention here pulsatile. So you have to imagine this picture, this mini crime thriller story, to remember all the features or external signs, peripheral signs of aortic regurgitation, pulsatile. Okay, so we'll see what does this not much interesting for many story will imply. Okay, so here we know that Cory gun's sign, first thing, is nothing but dancing carotid. So the carotid artery will be so much pulsatile that it will appear as dancing. So this is dancing carotid. Okay, then we told that pistol shot sign. If we keep stethoscope over the femoral artery, there will be systolic murmurs heard. So it will be like a pistol shot. So from distant, heart is shooting. That sound will be heard at the femoral artery also. So this is nothing but systolic murmur over femoral artery. This is pistol shot sign. Then comes collapsing sign. That is, the pulse will be collapsing in nature. Regarding that, I have discussed in detail in our video of pulse examination. You can watch it. So this is the description of pulse in aortic regurgitation. That is, it will be collapsing, or sometimes water hammer pulse is also seen. Then Hill sign is nothing but, when we measure the systolic blood pressure in lower limbs, it is more than 20 millimeter of mercury higher than the pressure in the upper limbs. So SBP of more than 20 mmHg when compared to SBP in upper limbs. And this is very, very important to grade the severity of aortic regurgitation, because as the pressure difference will increase between upper limb and lower limb, severity of the lesion will be more. So that is Hill sign. Then lighthouse sign. So what is lighthouse sign? over the face or forehead, there will be alternate blanching and flushing, because of the pulsatile arteries in the face. So over face, there will be blanching and flushing. This is lighthouse sign. Then we told that at the funeral site proper, the dear and dear ones are standing in queue. So here D stands for demusset sign. One more D stands for Desrosiers sign. What is demusset sign? There will be nodding of head with each systolic pulsation. So this is nothing but nodding of head nodding. What is Desrosiers sign? Again, when we auscultate over the femoral artery using stethoscope, there will be systolic and diastolic murmur heard. It depends on the level of compression. If you give compression proximal to the auscultation site, you will be hearing systolic murmur. If you give compression distal to the site of auscultation, you will be hearing diastolic murmur. So what is Desrosiers sign? Systolic and diastolic murmur over femoral artery in relation to compression. Then we told that dear and dear ones are in Q. Q stands for Quincke's sign. So this is Quincke's sign. What is Quincke's sign? When we press or give a firm pressure over the nail bed, there will be alternate again blanching and flushing, similar to the lighthouse sign, but it will be here in the nails. So blanching and flushing of digital arteries with each systolic pulsation over nail bed. This is Q. Then we told that there are other people who are standing in the surrounding and crying. So we correlated crying with pulsatile nature. So there are many structures in our body in this condition which will be pulsatile. So if we see that one by one, pulsatile uvula is called as Muller's sign. Okay. So you can remember second letter U with uvula sign. Similarly, pulsatile retinal arteries. So this is Becker's sign. Again, second letter with I. E for I. Then there will be pulsatile liver, which is named as Rosenbach sign. Then there will be pulsatile spleen also. That is called as Gerhard's. So this will be Gerhard sign. And we left with one more pulsatile sign. Here I will be leaving this sign for you guys. I will just explain that this is pulsatile popliteal artery. So you have to comment what this sign is called as in the comment section if you know this. Otherwise, the question will be answered. So these are the signs, peripheral signs of aortic regurgitation. Hope you got this. To just revise the short story. So this person, a famous personality, is being shot using a gun. So Corrigan's is nothing but dancing carotid. Being shot, pistol shot is over the femoral artery, whatever the pulsatile sound heard over the femoral artery. Immediately he got collapsed. That is collapsing pulse. Then his wish was to get buried near a hill with a lighthouse nearby. So hill sign is nothing but a sphygmomanometric finding. That is the difference between upper limb and lower limb blood pressure. So lower limb will be having more blood pressure. And next is lighthouse. So regarding face, there will be alternate blanching and flushing. Then near the central site of burial, there are dear and dear ones standing in a queue. So D stands for demusset sign. That is nothing but nodding of the head. One more D stands for Desrosiers sign, systolic and diastolic murmur in the femoral artery in relation to the compression. Q stands for Quincke's sign in the nail bed. And there are some people in the surrounding who are standing and crying. That is pulsatile uvula called as Muller's sign, then pulsatile retinal artery called as Becker's sign, pulsatile liver called as Rosenbach, pulsatile spleen named as Gerhard's sign, and one more is pulsatile popliteal artery, which is called as, which you have to comment, which is named after a famous personality. That's why I am giving you the work for you guys only, because it is an interesting sign. So these are the peripheral signs of chronic aortic regurgitation. Hope all of you have got it, and I hope you will remember this short story forever. Hope it helped. If you like the content in our channel, please do subscribe and try to share with your friends also for more such academic videos. Thank you so much.